This video is going to be about the Spinal Cord Independence Measure, or the SCIM. The SCIM is an outcome measure, and although there are 3 versions of the SCIM, the focus for this video will be on the 3rd version because that's the most recent one and it has the most research about it. One article described the SCIM-3 as a disease-specific instrument because the SCIM-3 is used specifically for patients with spinal cord lesions or injuries, and it would be appropriate to use the SCIM for individuals who are at least 8 years old. According to SCIM 2018, the SCIM-3 was recognized as the best available comprehensive SCL-specific functional status measure. Moreover, the SCIM-3 assesses one's independence in ADLs, and it looks at 3 different areas: self-care, respiration and sphincter management, and mobility. Within the 3 areas, total there are 19 items assessed, or 19 questions on the assessment that the clinician asks the client. The SCIM-3 can be administered either interview style or by observing the client physically performing the functional tasks. The interview takes approximately 10 to 15 minutes, but the observational method can take 30 to 45 minutes and sometimes even an hour. There are both advantages and disadvantages to both methods. For instance, according to SCIM in 2018, they found that the observational method was more objective, standardized, and quantifiable, although observation is more time-consuming. The study also said that the observational method is typically more beneficial in an inpatient setting, but the interview style can be used in both inpatient and outpatient. And the SCIM-3 requires no equipment to administer. So here's a better look of the 19 items that the SCIM-3 assesses if you want to pause the video and read through them. It looks like there's 17, but bathing and dressing are actually split up, so the upper body and the lower body are scored separately. So as I said, the SCIM-3 can be administered either interview style or through observation, and so in the following clips you will see both styles presented. When eating, do you need any assistance when eating, or do you eat independently?
I eat independently.
You don't use any adaptive devices?
Mm-mm.
Okay. When bathing your upper body, washing, drying, or even when turning the water on and off, do you need assistance? Are you independent in it?
I'm independent in it.
For upper and lower body?
Yep, for both.
Okay, how about for dressing your upper body? Do you have trouble putting your shirt on, putting your jackets on?
Nope, no struggles. I can do upper body all by myself.
Okay, what about lower body? And no adaptive devices for dressing or bathing upper or lower body?
Nope.
Okay. And then how about for grooming or keeping up with your hygiene? When you wash your hands or face, brush your teeth, brush your hair, or put makeup on, do you need any assistance, or do you groom yourself independently?
I groom myself independently.
No adaptive devices?
Mm-mm. Nope.
All right, Marissa, I'm going to have you walk up the stairs for me. Okay, Marissa, can you walk down the stairs? Okay, Marissa, I'm going to have you brush your teeth for me. Good job! So here's a visual of the assessment, and you can see each area in even greater detail. And on the right hand side is where the assessment is scored, and there's 6 boxes, so you can actually assess someone over the course of multiple weeks and track their scores and their progress along the way. Also on the assessment, under each of the 3 areas is a subtotal box. So self-care comes out to 20 points, respiration and sphincter management totals up to 40 points, and then mobility also is 40 points. If you look closely at how I scored Marissa with the assessment, she ended up with a total of 100 points, meaning she is fully independent. The greater the score, the more independent the individual is. When interpreting the psychometrics for this assessment and the spinal cord injury population, the minimal clinically important difference, the standard error of measurement, and the minimal detectable change have all not been established. Additionally, for individuals with spinal cord injury, there have not been norms established. The reliability of the assessment is moderate to high for inter-rater reliability and high for internal consistency. According to Anderson et al., 2011, overall the SCIM-3 is a valid and reliable measure of functional recovery for persons with spinal cord injury. When thinking about factors that might bias the assessment, someone with cognitive deficits would likely have difficulty understanding the instructions or understanding the questions, and they might not have the ability to answer the questions accurately. Therefore, I think it would be important for a caregiver to be there if somebody does have cognitive deficits. And in fact, a lot of the articles I've read actually exclude individuals with cognitive deficits from the study. Secondly, the lack of instructions could potentially bias the results. On the assessment, there really aren't any instructions provided. Therefore, the therapist really has to make a lot of clinical judgment when scoring and administering the assessment, and I think this could impact especially inter-rater reliability. Also, I think more areas of occupation could be included, and people might want to be independent in other areas besides self-care, respiration and sphincter management, and mobility.